Namaste. I am Dr. P.K. Shantakumari from Mata Ayurveda Eye Hospitals, Thiruvananthapuram. Today I am talking about something about NPDR, that is non-proliferative diabetic retinopathy. Because patients are asking some questions about retinopathy and non-proliferative retinopathy or PDR or non-proliferative and proliferative diabetes. These are confused. So one patient was asking, doctor, is there any special treatment for NPDR in Ayurveda? So I want to explain something about this NPDR and its analysis on Ayurvedic terms and a treatment on Ayurvedic point of view. Okay. Everybody knows retinopathy is a complication of diabetes, diabetic retinopathy especially. So, actually, this diabetic retinopathy is a pathological change on the retina. It includes a group of signs and symptoms, and if not treated in time, it is capable of leading to blindness. That is why people are afraid of it. And when we go deep into the condition, we can see that is not a single symptom or a single group of signs and symptoms. It is a vast range of pathological changes. That means when we say diabetic retinopathy, we can't say this is a symptom. It is not like that. It starts from one point and ends in another point. So the prognosis also varies accordingly. The treatment also varies accordingly. So, among these, one group is NPDR or non-proliferative diabetic retinopathy. When the pathology starts on retina, especially the microvascular system of retina, some changes happens in the blood vessels. And that is, first is congestion of the blood vessels, and sometimes there will be thickening of the vessel walls. Okay, so the blood flow will be slowing down. It slows down, and as a result, there will be bulging out of the vessel walls, and in turn, later there will be a tendency of leakages from the vessels. It may be fluid or even blood. So, on the retina, we can see small dots and blots of blood. This is the main symptom of NPDR. So, what will be the patient's complaints? There will be blurring of vision in this stage. And sometimes there will be mild edema like in around the eyeball and on the eyelids, especially in the early morning when you wake up from the bed. And then sometimes the patient will complain of some difficulty or hypersensitivity to bright light. That means when he goes out to sunlight or faces the artificial light, especially in the night, there will be some discomfort and the vision will be blurring. These are the main symptoms. In some patients, there will be some heaviness of the eyes or sometimes heaviness of the head in general. If the patients are having this type of symptoms, they have to consult an ophthalmologist compulsorily and get a differential diagnosis. Now coming to the Ayurvedic aspect and its treatment. In general, we can say diabetes is having a dominance of kapha. And sedentary lifestyle and overeating of this carbohydrate and sugar content food items and day sleep, all these things are capable of increasing kapha. And these are seen to be the causative factors of diabetes also, which affects in the pancreas, and the insulin level is decreased. That is very common and everybody knows about it. So, according to Ayurvedic theory, there will be involvement of kapha. And if this patient having the involvement of kapha or increase in the level of vitiation of kapha, and that patient is taking some factors which is capable of vitiating pitta, that may lead to this type of retinopathy changes. And the reasons are, sometimes it may be a pitta dominant patient, and say pitta prakriti patients, or if he is doing so many factors which are capable of increasing or vitiating pitta. And increasing the pitta or vitiating pitta, again we have to specify that those factors which are not suitable for the eyes. In Ayurveda, the term achachushya can be said in this aspect. Achachushya means which is not favorable, which is not suitable for the system of vision, system of eye, ophthalmic structure as such. So there are so many pitta vitiating factors, and all are not affecting the eye. But some specific factors will affect the eye. Of course, it will affect the eye. That type of factors, if the patient is practicing, then there is a possibility of affecting his eyes. And the disease complication may be diabetic retinopathy. So what are these factors? One is hot and spicy type of food items, and oily food items, deep fried food items, and sour tasted food items. These are capable of increasing or vitiating the pitta of the eye, or achachushya pitta vitiating factors. And about the habitual factors, exposure to bright light and focusing on light source and head down postures, these are all factors which are capable of vitiating the pitta of eye. So the above said factors, the pathological changes happens in the eye. So here we have to consider, when coming to the aspect of treatment, we have to consider the nature of the body nature of that patient at first. If that patient is having a dominance of kapha in his prakriti, that means body constitution, we have to start with the kapha, draining out of kapha, that type of treatment. Ayurveda will say shodhana, kapha shodhana chikitsa. So for that, there are very successful treatments such as Nasya, that is special type of nasal drops, and then Shirodhara, like then Kabbalah, that is type of scientific level of gargling, and then comes applying medicine over the eyelid and eye drops. These types of treatments are very effective in this stage. So, what is the purpose of this treatment? The aim is that to maintain the circulation or normalize the circulation. That is the first aim of treatment in this stage. So that the tendency of accumulation of fluid or congestion of the vessels will be avoided. So that the possibility of blockage and possibility of leakages will be avoided. That is a line of treatment in Ayurveda. Okay, so if you are diagnosing the situation in time and analyze it in this stage on the basis of Ayurvedic principles, we can start a treatment and it is highly successful. And we can avoid the further progress of the disease and other type of complications and loss of vision, blindness, etc. can be avoided. Okay, that is about NPDR in the viewpoint of Ayurveda. Thank you. I am Dr. Shantamari from Mada Ayurveda Eye Hospital.